Quick announcement before this episode. Got some good stuff for you guys here. This episode, we are joined by Mary Mosier, licensed marriage and family therapist and a person with diabetes living with T1D. She previously visited us on episode 199, where we talked a lot about therapy and trauma and grief associated around diagnosis with diabetes. And we realized there were a lot of things that we didn't have time in that episode to cover that are instrumental to a person with diabetes journey with mental health and also starting therapy. So, for November 2022, National Diabetes Awareness Month, we're dedicating our content towards mental health. And we have a new page on diabeticsdoingthings.com, diabeticsdoingthings.com/mental-health. So, slash mental-health. And on that page, you can find all of the episodes in this series with Mary Mosier. But also, we're going to be posting previous episodes related to mental health on that page. And most of all, during November 2022, we are giving away 4 scholarships to see Mary Mosier and to get 5 therapy sessions with her. So 4 scholarships, 5 sessions each. Say that 5 times fast. 4 scholarships, 5 sessions each. And in order for you to win, you must live in California. So what I'd like for you guys to do is to, if you live in California, go to diabeticsdoingthings.com/mental health and enter the giveaway, or send it to someone that you know with diabetes living in California. There are 5 episodes in this series, and the first episode is also broadcast in Spanish. So it's our first Spanish only episode on the podcast. So shout out to Eritrea and for Mary Mosier for being willing to do that in both languages. So again, check out diabeticsdoingthings.com/mental health during November National Diabetes Awareness Month 2022. All right, let's get to the episode with Mary Mosier. Okay, as we continue with our mental health series, we have Mary here who is going to talk to us a little bit about grief and also how grief is related to a life with diabetes. So I think just for starters, like how can we talk about and how do we define grief, especially in a therapeutic and a mental health practice?
Yeah. So when we talk about grief, we are acknowledging a loss, right? So that experience will bring up every feeling. And for some of us, it'll bring anger, it'll bring depression, it'll bring anxiety about the future. And we all experience grief so differently. So I know that when we talk about like the stages of grief, it isn't linear. It isn't just like I marked and passed phase 1, so let's move on. That's not how it works. It's kind of on a spectrum and it oscillates back and forth, right? Where we might start in with denial and then move to anger, then we might bargain, then we might experience depression where like crap, like I need to stop avoiding these feelings, and to a later stage is accepting, right? What that life is going to look like, knowing that it's going to be different, right?
I think too, for me, I was very fortunate in like most of the early years of my life to not have to deal with like a true major loss, especially of someone close to me. And I think losing my dad a few years ago now really was that first kind of like real discovery of like that cycle. And, it's not overcoming denial one time. It's not getting over anger one time. It's not reaching acceptance one time because it does like continue to flow and it is on a spectrum as you mentioned.
Yeah.
And I think that was like really my first understanding of like cycles and how they work for us as people and not always in our control as well. So even years and I think the cliche is time heals all things. That's true, but not if you stay in that denial phase, right? So you can unfairly handicap yourself by not really addressing that grief and staying in that sort of denial phase.
Yeah. I mean, we certainly want to acknowledge like sometimes for some of us, the denial phase is like essential given our lived experience, and it really serves, especially in the survival mode period of the grief, where we're kind of like powering through, because that feels a little bit better. Not that it feels good to be in denial, but that is more manageable than all the other feelings or experiences that we're having. But you are completely right. Like if we were just in denial, we wouldn't be able to move through our emotions and we would be stuck, and that would affect our ability to function and engage with people and work and love our loved ones, right? If we're just kind of avoiding this change in our life, right?
For me as well, a thing that I had to learn, and I fortunately, this was actually one of the kind of triggering events that caused me to really dig into a longer term therapy practice with my therapist, was my first response, my denial response looked more like compartmentalizing.
Mm.
And for me, that was okay, well, I'll have time to grieve after everybody else does. And after I make sure that all of the things are in order. So I kind of like, that was part of my grieving process, was fixing all of the aftermath and kind of being the go-to person. And that was, derived a lot of worth from that. But months later, I realized like those compartments, just because I'm compartmentalizing them in my mind doesn't mean that they're not related. Doesn't mean that they're not crossing over. And so, it doesn't just look like denial, anger in a vacuum, but those
Yeah,
things definitely affect the other, interactions in your life.
for sure. Because like the point of denial is like to self protect, right? Temporarily, like in numbing, and as we're experiencing this confusion, like we're shutting down in many ways, and sometimes it looks like we're completely fine, where you're like, I'm okay, it's okay. um you might be forgetting, you might be procrastinating, you might be avoiding. So that's how it can certainly present itself in different folks. And again, it definitely does oscillate. I know for folks with diabetes, sometimes when I'm working with younger folks or folks that are diagnosed with maybe type 2 at a later age, they're not checking their blood sugars. They're not bolusing or taking their medication because they want to pretend like it doesn't exist, and that's their state at that given time.
Totally. And I think recognizing, and we've talked a lot about awareness, asking yourself kind of where I am in my grief cycle related to one event or another.
Mhm.
I think for me, is this a good practice? Is like, okay, well, why am I feeling this way? And what caused me to feel this way, and really digging into like, oh well, this reminded me of something that I had forgotten about, or there was even a fond memory sometimes can trigger grief in someone. And
Sure.
I think with somebody with diabetes, like obviously this is diabetes focused, and we've talked about how closely related mental health and diabetes are.
Mm.
There's a component of grief too, no
Yeah.
matter when you were diagnosed, whether that's as a very young person in your case, or in your teenage years like myself, and kind of in between for Eritrea.
Mhm.
There's grief associated that can be lifelong, and that cycle may not be very aggressive at times, but it certainly rears its head from time to time.
Yeah, and that's absolutely true, because I think, like, again, some folks will think like, oh, the stages of grief, and that was just kind of written as a way to understand grief, not to say like this is the flow. And if you're not in this particular flow and doing these steps at this particular time, then something is wrong with you. It was just a way to understand grief. So it does for sure ebb and flow, and it is often most heavy and painful in the beginning, and then we find how to move with that grief as we're learning about ourselves, as we are learning to accept and to feel our feelings and to really build that self-compassion. Because I know that word, or like self-love or self-compassion, gets thrown around, but we do need to kind of love on ourselves when we experience grief. And just in general, as human beings, we need a little tenderness, whatever experience that we're having, but specific to grief, to be like, gosh, this is hard. How can I love on myself, nurture myself?
Acknowledging that difficulty, I think
Yeah.
we've talked about that a lot on this podcast. Even my own contributions to kind of like the toxic positivity around diabetes, like certainly it exists. At the same time, I think that there is a benefit to kind of finding the good in all of those situations. At the same time, it's also exhausting. So getting
Yeah.
to understand the balance between those, and uh I think you mentioned it on a previous episode.
Mhm.
Hey, if you didn't get a good night's sleep, recognizing what you need in order to feel good in that moment, because you're acknowledging like, oh, hey, there's going to be a difficult day ahead. Let me fill myself up with the things that nurture me. I think
Mhm.
that that is something that is a really, really like salient practice for somebody with diabetes, because some of, we talk about controlling what you can control.
Mhm.
There are some diabetes variables that, despite our best intentions, are outside of our control. And what do you do when that happens is, I think a really good question to ask yourself, because certainly it's going to happen.
Yeah, and I think we're all so different in that way. So to like specifically say like you have to do this would not be ideal, because I think we need things in different ways, right? So for me, like because I've been doing this work on myself and like connecting with myself and my body, I know that if I just spend a little bit more time in the sun, or like right now I have this window on my right side, and on maybe on a tougher day, I make sure that that window and that fresh air is coming in a little bit more than in a day where I'm feeling neutral or just fine, right? So like even just that piece of acknowledging, hey, this is really crappy right now. I don't see the silver lining, and that's okay. And also like it's okay if you can't find the good in it. Because sometimes, like, and I know some people like to use the phrase everything happens for a reason. Sometimes there's no reason, and that's okay too, right? Like that we don't necessarily have to find the silver lining in all the things. And that's I think it's good to just say like, yeah, this does suck, but what do I have control over? What can I do despite like this incredibly high blood sugar and I'm doing all the things? How can I create ease, or how can I enlist someone else to help me on this very tough day if we do have that resource, right? So,
And when you're working with your patients, I mean, you mentioned for you, it's your window, sunshine, fresh air, and nature, and a connectivity to that. What are
mhm.
some of the methods that you and your patients use to
Yeah.
address those sort of micro moments of grief?
Yeah, so I know with a lot of folks that I work with, especially if they're needing a bit more of that like self-love support, we might acknowledge that something is difficult. So someone might say to themselves, I know it's hard and I'm learning to love myself through this. For someone else, it might be I'm listening to Rage Against the Machine and dancing around in my room because I'm so angry that today is just feeling so crappy. I think music playlist can be helpful. I know some folks will want to do some somatic touch based things, or maybe they're putting their hand over their heart and they're acknowledging that it's tough and that they deserve better and this is going to be a rough day. But what can I hold about me that is still good, right? Because me not controlling my diabetes every day doesn't make me a bad diabetic or a bad person, right?
And,
And then also,
and
who do we follow? Who do we follow on Instagram? Because sometimes, like, seeing all those happy people with like, look at my pump, like that can be really annoying. So even just paying attention to the media we follow, because I know some folks with chronic illness with diabetes, they tell me that like it's really annoying to see people looking so happy. And I'm like, I'm sorry, don't go on my page because I'm doing something, I'm posting myself looking happy with diabetes
Follow
today.
me, follow Eritrea.
Yeah.
Come on over
Yeah.
to Depression Central.
Girl, yours are positive too, but just like it's okay that not every day is going to be rainbows and sunshine, because it's not meant to be. We're not always meant to be happy all the time, but like, how do I take care of me? What does that look like? A longer shower, me telling my mom or asking someone for help because I don't want to pay attention to my blood sugars or the carb counting. Can my partner do it? Can my sister do it? Can my friend do it because we're going to go out to dinner? Like, can someone take a walk with me? Like, what could be helpful? What is the thing that is in your control? Because I think we're all trying, and we can acknowledge that I'm trying, even though it sucks right now.
oh, that's such a good thing to acknowledge. Like, oh, I'm putting effort. And I
Yeah.
think that's sometimes for me personally, the times where I feel the lowest is where I am putting a significant amount of effort into something that I know is going to be good for me, but I'm not seeing the results yet. Or maybe the results just aren't like as cool as they would have been, or, they're not as straightforward or as binary as like, oh, if I do bicep curls, my arm muscles are going to look,
Yeah.
big. or whatever, or look, toned or whatever. It's
Yeah.
more like, uh, and, for me, like a really like silent journey I was basically on for the last 3 years is like unlocking mobility in my hips, which is not
Mhm.
like a thing that as a kid in pre-K, wish for as like who you want to be when you grow up is like, oh, I want to be a person with mobile hips. And yet at the same time, like it has unlocked for me like a very pain-free life that I have worked really hard for and had to celebrate minor, like very minuscule gains in. And
Yeah.
that was an interesting practice for me. But I'm on a rabbit trail now. I want to come back to the main thing. Like, also, you don't have the things that you do for yourself to comfort yourself in those moments of grief, or in those moments where you're feeling low, don't always have to be like super positive or like adding to your, health or wellness, or, a quote unquote right thing to do. Sometimes it could just be like watching a movie, or associating by watching a TV show, or
Yeah.
eating a snack that makes you feel good.
Mhm.
I know I'm kind of like a psychopath, and like all the good things that I do to try to keep myself in the right frame of mind and my ability to meet the demands of my life. But I
Mhm.
also am a real person. So sometimes I just need a bag of Cooler Ranch Doritos while I'm at 7-Eleven. You just need something to like,
Yeah.
get a little dopamine hit, get something that's like, you know what, I'm going to take 5 and address my needs as a person before I get back to, whatever it was that was stressing me.
Yeah. Because the goal is not like, I'm never going to be non-judgmental again. And even like the way that we speak of it. So you like, you eat your Cool Ranch Doritos, right? Like it doesn't have to be like always salads, right? Or like it doesn't have to be, for me, it doesn't always have to be nature. I think one thing that people don't realize, even like with watching that TV show that we've seen 20 times, it is comforting. And it, for some folks, it can be a disassociation or a distraction, but for other folks, it regulates our nervous system because we know how it starts and ends. And sometimes that's what we need to see over and over a few times, right? Or like I go to the same coffee shop because I know the people that work there and I know how this is going to start and end. So, like knowing what to expect can be really comforting.
Well, we're humans. We thrive in a routine,
Yeah.
and that's like an important part of our biology. So creating those predictable, controllable kind of moments that you can depend on is really
Mhm.
important.
Definitely. Yeah.
So from a patient perspective, if you're dealing with grief, or you're feeling grief and mourning sort of your old life, or something related to your diabetes, like what's a good way to bring that up in your therapy practice if you haven't done so already, or you're looking to sort of look for more help?
Yeah, definitely using your own language, but just like even saying, I realize that I'm having a hard time with this transition from being pre-diabetic to me, like, and I need to process what future me is going to look like, or what me in this moment is going to look like. Because I had this idea before we started, and now my dream needs a little adjustment. It doesn't mean that that dream is going to 100% change, so we can still do the things, but the pace might look different, right?
I love the way that you frame that, because a huge benefit that I had, and I've talked about it a million times, but it
Mhm.
bears repeating, is that at the beginning of my diagnosis with diabetes, my care team came into the hospital room and they said, "Hey, the dreams that you have for your life are still within reach, but there was a change. There was like, as long as you take care of your diabetes, and like a
Yeah.
new, this new kind of variable."
Mhm.
And I needed to hear that, because I'm like, I'm a thinker. I break things down into the steps to make them happen.
Mhm.
And so that then it became, okay, well, my dreams are on the other side of this diabetes management. I want my dreams, so I better apply that same, dedication to the diabetes management. So it's important to remember, though, that like your dreams, the change can be difficult and like is unfair. And I think acknowledging that as well is very just important as a person.
Yeah, I would agree with that because it is important just to say like, this is hard. This was not what I was expecting, and I need support in this transition. I I need support in knowing that I can still be me with this diagnosis, or with this change, or with this experience that I just had that has shifted my my worldview a little bit.
Well, I think too, it's a really good parallel along with diabetes is talking about grief and talking about mental health in general, because I think for people like me who are very like task and type A oriented, we think like, okay, well, if I do these things, eventually I will reach a finish line and a level of mastery where I'm not going to need assistance anymore. I'm not going to have these problems because I've mastered them.
Yeah.
And like, I don't know, just life really doesn't work that way. It's sort of just one unsolvable problem after another after another. And the to-do list is never going to be empty. And you put down your pencil and you to look out your window on a grateful universe and it's all in balance. And so I don't know, it took me a lot of work to really relieve myself of that notion that one day I'll be perfect and I won't need this stuff anymore.
Yeah.
So
Yeah.
yeah, I think it was a really interesting parallel between life with a chronic illness that is never ending and life with struggles and challenges never ending, as well as grief, which, comes in ebbs and flows but really you carry with you.
Yeah, absolutely. And then also knowing like with those struggles, there are shifts that are going to happen. Again, like the heaviness isn't always going to be like at the first moment of diagnosis or the first year of diagnosis. We will learn our bodies, we will understand them a little bit better. And maybe knowing that our blood sugars fluctuate or we have these like highs and lows of blood sugars and also our mood, like how are we staying present in those moments that are extra good? How are we savoring those? And then when they're hard, what's 1% that I can do to decrease this for just a little? Like, what's the thing that I can do? I can't take this away, but what's one thing that I can add to create ease or comfort for me? Even if it's not something major or long standing, just enough to kind of help me get through that day.
I love what you said about 1% better. I think that's a mantra that is applied a lot through this type of work.
Mhm.
And I think it also really resonates with that lifelong marathon, not a sprint type mentality where if today I'm only comparing myself to myself, and if I'm showing a step forward in the right direction, like that's something to be grateful for. That's a win that I can celebrate. It may not be a big push, it may not be a giant celebration, but there's one thing and I'm applying myself toward that and I feel validated in that effort.
Absolutely. Yeah, because I don't think we validate those small wins enough. I think we always think about the big things like I graduated college, I bought a new car, or I got married, or whatever it is. But it can also be like I worked through this like unnecessary cycle that I'm letting go of, and or I'm practicing non-judgment, and that's awesome. Or I did this on my own, or I did this with the help of people for the first time. I like advocated, I asked for help, and that's growth for me, right?
Well, I think too, like how much of those are external validation versus internal validation?
Yeah,
Like
I think the
celebrating
internal
yourself
stuff is the
when,
long standing. The internal stuff is the long standing because like when we think about like internal and external, like deep versus superficial, like the internal stuff is the things that make the biggest difference in our life, not like the cool car I just bought. Although that's awesome if that's a life goal, you want that cool car. But how are we resourced to kind of move through the world outside of the cool car?
I think too, something I've learned recently is, we don't see the world as it is. We see the world as we are. So what's important to you is what's important to you. And so, if you're having a hard time giving yourself credit for something, maybe you just need to reframe those priorities just internally and be mindful and be curious about maybe why that is. And I think when you are engaging with that, that is mindfulness, that is mental health, that
Definitely.
is the meditative. It's not a finish, and there is no big celebration. No genie pops up and is like, congratulations, you figured it all out, welcome to bliss and harmony. But that really is that, like, oh, I recognize this,
Mhm.
I have sat with the feelings and I'm able to take a step forward,
Mhm.
and I am in control of making that change. So this is, for those listening, this is the last of our November 2022 sessions with Mary Mosier. So I did want to express my gratitude for you for taking the time to spend with our listeners and for all that you do for your patients, but also people with diabetes. So thank you. So thank you for your time and your guidance and partnership with Diabetics Doing Things. That it truly is wonderful to be able to work with you, and it's exciting to get to open up other possibilities for people like us who could use some help and some inspiration and some tools.
Yeah, happy to be here. Thank you so much for having me.